All right, good morning, everyone. This is February 6th. We are in Unit 5 or Week 5. Assembly and packaging and sterile processing is our topic for this week. There's a lot of important information to cover in your chapter this week. So here are our objectives for Unit 5. We're going to learn how to demonstrate various wrapping and packaging techniques and the use for materials to prepare items for sterilization. So that is the main topic in your chapter, which should be chapter 12. Here are your assignments for this week. Your first post for your Unit 5 discussion, remember, is due on Wednesdays. And then your subsequent post to your peers, which should be 2 different people, is due by Sunday evening. So make sure you're getting both of those in for full credit. This week we only have one chapter to go over or for you to read, which is chapter 12. So it is a little bit less than some of the other weeks, but there's a lot of important information in chapter 12 because a lot of what you will be doing in sterile processing goes right back to this chapter on how to process and package those items for sterilization. So a lot of important information in this week. So how do instruments go from decontam to being used in the operating room? So, up until this point, we've discussed how to clean instruments at the point of use, how to bring them down for preparation, the decontamination process. You guys did a great job on your cleaning videos. I really enjoyed watching those from your kitchen. You guys did a great job on demonstrating that. So I think that was a good hands-on experience for you guys since some of these programs are online. So that's a good thing for you guys to do. So we've gone through that process, the decontam. It's going to go through the washer decontaminator, I should say, to go from that dirty side over to the clean, because remember, you can't cross clean and dirty. So after they go through those washer decantams, then they can go over to the clean assembly area of the central services department. That once they go through those decontam machines, they're now safe for you to handle. It doesn't necessarily mean they're sterile, but it has gotten rid of enough of the pathogens that make it safe for us to handle, to repackage, process the correct way, and get them ready for sterilization. So what are some of the main guidelines we use for pack preparation? For one, there's tons and tons of different types of packs. And learning those is just going to come with time. And your facility is going to be different than somebody else's because a lot of the packs or trays or whatever you want to call them are based on like surgeon preference. A lot of surgeons will have their own tray, especially at our facility. This is Dr. Rudolph's tray that, and nobody else uses it because it's been made for the things that he likes to have. So his particular forceps that he picks out that he wants for every case. So a lot of facilities will do that and they will call them those trays based on that surgeon, or they may put together a tray that just says, major laparotomy tray. And these are the things that the OR staff thinks should be in that tray. So those will be available on like what's called a count or a pick sheet. It could be paper. You could have a whole binder of these to show you exactly what's in each tray, or a lot of facilities have gone to digital now, so you could also look it up that way. But you will have something that tells you exactly what should go in each tray. Prior to putting them in the tray, you want to make sure that all of your instruments have dried since they've gone through that washer decontaminator prior to being sterilized. You don't want to put a whole bunch of wet instruments in a tray and then put them in the sterilizer. It could still end up with a wet pack. The exception to that rule are lumens. So for example, like your Fraser suction or Yankauer suction that has that lumen, the hole in the middle. Usually with those, you want to keep a little bit of water in for the steam to kind of stay in that lumen and break it apart, and it'll eventually dry. Instruments are inspected for. So as you are reprocessing them, packaging them, you have to check every single instrument that goes in those trays or those packs, because if you miss maybe let's say a scissor that has like a dent in it or a chip and you send it back up to the surgeon for use, that surgeon is going to see that when they start to cut on the tissue, and it's going to make probably the surgeon mad for one, because it's not going to work properly. It could even cause more damage to the tissue on the patient if it's not caught. So it has to be a priority. Instrument inspection is very important. It's a huge part of the job. You want to inspect it for cleanliness, making sure that, maybe at that decontamination sink that everything got scrubbed off, no bioburden was left. Functionality, do the scissors open and close easily? If it's like really hard for the scissors to open, it's going to be hard for the surgeon, and it's going to make the procedure difficult for that surgeon, and that's not what we want. We want to make sure that it is seamless as possible, and that the procedure or the case goes very smoothly for that patient. So it all comes back to sterile processing and making sure that the equipment we have ready for that surgeon is, up to par. We want to make sure it's perfect. So always inspect for damage. You're going to look for things like maybe an instrument got chipped, or there's a tiny scratch in it that could hold bioburden, or maybe the clamp doesn't shut right because it got bent. Maybe scissors aren't sharp enough. That could all caused by damage. Also, you want to make sure that all parts of the instrument are present. And some of your videos for your decontamination in your kitchen, you use the Yankauer section. With that metal Yankauer, the tip of that does screw off. So when you're cleaning that, make sure that it gets unscrewed so you can get in those grooves. And it also needs to go with, the whole thing. It has to be sterilized apart. Otherwise, the sterilization isn't going to get in the groove. So that part does come apart. So you'll learn what instruments have removable parts, and, making sure that they get sent all together. It's easy to lose those little pieces that come apart for sure. And these guidelines definitely must be followed. Otherwise, the patient isn't going to have a good outcome, maybe due to a delay. Maybe you had to go find something else that worked properly, or maybe due to it just didn't function right on the tissue for the surgeon, and we don't want that. So with our trays, there's a couple ways we can do trays, and we'll talk about those in a minute, but instrument holding trays also have a set standards or guidelines. Always, again, check the IFUs for the trays being used. Some trays or tray manufacturers have a little bit different IFUs than others. A key thing is don't overcrowd the trays. You don't want to shove it as full as possible, because that's not going to allow for especially like the steam, to penetrate completely through the tray. If everything's all squished together, it's not going to give enough space between for the sterilant to reach all of the surfaces of the instruments in that tray. So you don't want to overcrowd. You always want to keep trays under the maximum amount of 25 pounds. Anything over that, you're going to end up with, it can mess up the sterilization process for one, and it becomes very heavy for anybody that has to maneuver these trays or pick them up or use them in surgery to put them on the back table. So 25 pounds is the max. Always protect instruments from damage. There are a couple pictures in your book on how to do that. Sometimes we have these little like silicone or plasticky things that go over the tips of really delicate instruments. We don't want to damage the tips of delicate instruments, because then they're just useless. So that's one way we can do it, is actually putting something over the tips. You can put them in like special holders to keep them in a line. You want to make sure that nothing heavy gets put on top of the delicate instruments. So definitely make sure you go through this processes to protect those instruments from being damaged. Hinged instruments like your coker clamp or your hemostat, anything like that, should be unclamped during the whole sterilization process. So when you're lining them up in your tray, you're restringing instruments for your tray, make sure they stay open. Sometimes it's easy for them to kind of ratchet shut a little bit, so you may have to do a double check just before you close that tray up. But if you clamp them and send them through the sterilizer, what is in the clamp, like as it's shut, the sterilant isn't going to reach inside that clamped area. Okay, so that's super important because that could contaminate an entire case. If the tray gets put up onto the sterile field in the OR and there is a clamped instrument, theoretically, the surge tech should break down that entire back table because it's become contaminated. So then you've got a delay of case and you have more time that you're wasting. You're wasting the patient and the surgeon's time, which we don't want. So something as simple as just making sure a hinged instrument stays open can affect the course of a surgical procedure. So also this little fan down here, you'll see this in your book too. It says, remember FAN stands for functional, accurate, and neat. You always want to keep your trays functional, accurate, and neat. So everything will be lined up nice and neat. You want to make sure that you've checked your sheet to make sure everything's there and everything is functional. So in each of these trays or packs that we're going to be making up, you always have to have something called a chemical indicator. So here's just an example. There's some more pictures in your book, and they're different brands. Different brands will look different, and different chemical indicators for different sterilizers will look different as well. So this one is for the steam sterilizer. Just shows you the difference between one that has passed the steam sterilizer test and one that has failed because it went through the black. If you look here, if it stays in this reject area and not into the accept, it the conditions for sterility have not been met. So anything in that load cannot be used. It has to be reprocessed. And we'll troubleshoot that later. So everything that gets sterilized has to have a chemical indicator. Because if it doesn't, how is the surge tech supposed to know that it went through the correct process? How do we know that the conditions for sterility have been met? And this chemical indicator does not necessarily indicate that what is inside that package is sterile. The only way to ensure sterility is the biological indicator, okay? That's the difference. Chemical indicator is just saying, yes, it did go through the sterilization process. It met that 270 degrees at whatever temperature for that instrument, and it did go through the load properly, okay? So it has to be in everything, every pack, on inside, outside, hardest to reach areas in the tray has to be there. Also, if it's in a multi-level tray, sometimes our big, let's just say orthopedic trays, have multiple layers of instruments or supplies in them. You should put one on every level, okay? Because if you only put one on the top, it doesn't necessarily mean that the conditions for sterility were met on the very bottom. It's more often that the one on top would turn correct and the one on bottom would not turn. So you want to make sure that every single tray level will have a CI. So here are some of the different types of packing material. So it's important to select the appropriate type of packing material for what you're trying to package, right? So one of them is there's a woven category, which is usually your muslin. It has to be 140 thread count minimum for muslin. And it is typically a 2-ply wrapper. So you see pictures of like the packaging that you're wrapping up, that is your muslin. It's that blue, it's usually blue. And it comes in different sizes. We also have rigid containers. Sometimes these are called caskets or gaskets. I've heard them both ways. It has 2 containers. You have that rigid outer container that will then hold like a basket or a tray inside of it, which would get removed and put on the sterile back field in the OR. So they are sealable. They have a lid that comes off. They are made of typically some sort of stainless steel or aluminum, or maybe the lid is even plastic. So there's a variation of maybe a couple different types there. But it does have that inner basket that holds the instruments. That's what you're going to be assembling, that tray of instruments, and then putting it inside that rigid container and then sealing up the lid. And then you also have these peel packs. There's a couple types. You have some that are good for steam or ETO, which is that paper plastic combo. One side is like a paperish, the other is plastic that you can see through. But it's important to remember that the sterilant cannot enter through the plastic side. So when you're laying them in that steam sterilizer, you wouldn't want to lay it in a position that the steam could not get through the plastic. So it has to be lined up, like sitting on its side so the steam can get through properly. The other one is like this Tyvek peel pack. So they do look a little bit similar. It's a spun-bound polyolefin, however you say that, plastic, which is more suited for the Sterad or the ozone particular sterilizers. So you have to choose the correct one. So here are the techniques step by step on how to do the sequential envelope fold wrapping technique. There's a couple wrapping techniques mentioned in your book. This one is very common. The envelope fold is something you'll use all the time. So here are the steps, step by step. Sometimes I think it's a little bit easier to watch it done than to read a step by step. So I did include a video on the envelope fold as a demo method. So this one's just a short little video. I have a couple other videos that I'm going to play as well for demo. So hopefully the sound works through here as I play this. There you have the envelope fold, and notice on the outside she also put a chemical indicator, but it's in the tape form. So that tape will also turn black once it's been through the sterilization process. So chemical indicators on the inside and out. Next one. So this one I included is the Smart Fold wrapping system. I found this one and wanted to include it because it's kind of a newer, I don't, maybe within the last even 10 years, but some facilities are starting to go to this particular type of wrap. And notice it has a couple extra like straps almost, but it's to make it a little bit quicker than having to maybe like use your elbow to try to, keep your folds from undoing. So this is the Smart Fold wrapping system.
So how does SmartFold work? Let's look at it once again, step by step. Select the correct size and grade of SmartFold for your tray. SmartFold comes in a range of sizes. Once you've laid out the wrap with the blue area away from you, position the tray for wrapping. Place the front edge of the tray at the reference line, not at the edge of the white area. Both sides of the tray should fall within the blue reinforcement zones. If both sides do not fit within the blue reinforcement area, select a larger or smaller size of SmartFold. Begin folding as you normally would, bringing the wrap up and over the tray so that the front side of the tray is covered all the way to the work surface. Hold the corner lightly and tuck and fold the side in as usual. Now pull the side tab up and over the top of the tray and secure it with the positioning strip. The strip will keep the tab in place while you complete wrapping. Repeat the process from the other side, again patting the side tab into place on top of the tray. Bring the outer ends of the flaps together, like this, or overlapping. SmartFold's ergonomic design features keep the fabric in place without elbows or awkward bending and twisting. Now, tucking the front corners slightly, reach over and pull the blue section up across the top of the tray. Note that the top section is less bulky for a nice, neat closure while still providing a full 3 layers of protection to the tray. Tuck the front and under, neaten the edges, and tape with indicator tape as usual. Now process your SmartFold package for sterilization, exactly as you would with one step. SmartFold has been approved for both pre-vac steam and EO processing. Finally, transport and store trays wrapped with KimGuard SmartFold, just as you do packages wrapped with KimGuard and KimGuard one-step wrap.
There's the one-step smart fold system, which is very handy. You can see that it's a little less cumbersome to try to make those folds. So I know our facilities in my area have gone to using that.
Halyard Health offers a knowledge.
Sorry about that. So this next video I put on here was talking about tear identification and handling techniques for your wrapped items. I thought it was a really good video on how to maybe even troubleshoot some of the issues you might have with the wraps. So this one's a little bit longer, but I think it's a good video.
Welcome to the Kimberly-Clark Healthcare
Sorry
and
about that.
College Network presentation entitled Sterilization Wrap, Tear Identification and Handling Technique. This is one of our Excellence in Sterile Processing programs that addresses critical issues in healthcare. At the end of this continuing education program, you should be able to list 3 factors that can compromise the sterility of a wrapped package, identify the types of tears that can occur in wrapped packages, describe the possible causes for these tears, and discuss proper tray handling technique that will assist in preventing these tears. After sterilization, factors that can compromise the sterility of a wrapped package are moisture, soil, and physical damage. Let's review these factors. After the sterilization process, packages may become moist from causes that include touching sterilized packages before they are cooled, placing the package on a wet or damp surface, carrying the package tucked tightly under the arm where it can come into contact with the warm, wet armpit, or from handling the package with wet or sweaty hands. Sterile items that become wet are considered contaminated because moisture brings with it microorganisms from the air and surfaces. A second factor that can compromise the sterility of a package is soil, such as dirt, dust, and debris. This soiling may result from causes that include incorrect or excessive handling or from unclean storage facilities. A third factor is physical damage to the package. This can be caused by dropping the package on the floor or another hard surface, through rough handling and manipulation of the package, such as forcing it into a tight storage space, or by stacking heavy packages. Packages that are wet, soiled, torn, or dropped onto hard surfaces should be considered contaminated and unsafe for use. If there is any doubt about the sterility of the item, it must be totally reprocessed before it can be used safely. For the purpose of this program, we will focus on the third factor that can compromise the sterility of a wrapped package: physical damage. Improper handling is a major cause of physical damage and contamination of sterile packages. One cause of improper handling and stress on the sterilization wrap is heavily weighted trays. For instance, as surgical procedures become more complex, so do the instruments and trays that support them. That often means that the weight of the trays has increased, making it more difficult for sterilization wrap to withstand the greater pressures of heavier instrument sets, especially when handled and moved improperly. Other examples of improper handling include manipulating wrapped packages with long fingernails that can rupture the package material, Inappropriate storage, resulting in crushed, bent, or compressed packages, and dropping packages. Dropped packages should be considered contaminated even if no damage is apparent, since the jarring and compression on landing can force dust and airborne microorganisms into the package. The consequence of physical damage is often a tear or ruptured seals that could result in contamination of the tray contents. Physical damage will most typically occur along the bottom tray edges and at the corners. The following is a review of wrap tears. There are three types of wrap tears: cuts, holes, and abrasions. Several types of cuts may occur. A knife cut is almost always straight. The edges are clean rather than frayed and can easily be pulled together to make the wrap appear intact. A knife cut generally occurs on the top few sheets of the first bundle of sterilization wrap when a knife is used to open their packing box. At first glance, a pressure cut may look like a knife cut, but upon closer examination, one can see that the fibers around the edges of the cut have been welded or stuck together. The edge of the cut may feel hard to the touch. Pressure cuts may be seen at the perimeter or outline of the bottom of the instrument tray, or at the top of the instrument tray if trays are stacked on top of one another. Pressure cuts can be caused when all three of the following factors are present. The wrap is sandwiched between two hard surfaces, excessive pressure is applied, and the tray is pulled or dragged across a smooth surface. Another type of cut is a snag cut. The edges of a snag cut show loose fibers hanging from the edge of the cut and/or there are individual fibers spanning the width of the cut. The edges of a snag cut are not hard as with pressure cuts. In larger snag cuts, the shape of the cut usually resembles a triangle, with the point of the triangle being where the snag began. Snag cuts are generally due to the tray being pulled or dragged across a rough surface, such as is often found in an older, well-used sterilizer cart. If the tray is very loosely wrapped, snag cuts may occur along the edges of the wrapped instrument tray. They can also occur on other areas of the tray where the wrap is too loose and can be caught by rough surfaces, corners, or edges of objects. Holes are yet another type of wrap tear. A pressure hole may appear as a tiny opening, less than 2 millimeters in length, where the fibers around the edge of the hole have been welded or stuck together. They are usually found along the perimeter of the instrument tray. This type of hole is caused when the wrap is sandwiched between two hard surfaces, such as when heavy trays are stacked on top of each other. Or a pressure hole may occur when excessive and/or sudden pressure is applied. An example would be when a package is dropped on a hard surface. Another type of hole is the snag hole. This hole is triangular in shape with loose fibers hanging from the edges. A snag hole may result from the wrap getting caught on something, such as a rough surface or a burr on a sterilizer cart. A puncture hole is characterized by frayed or loose fibers attached to the edges of the hole. Typically, this type of hole will not have hard or welded edges. The most probable cause for a puncture hole is an instrument in the tray becoming loose and puncturing the wrap from the inside. If tip protectors are used and instruments are anchored appropriately within the tray, this type of hole can be prevented. The tiniest of holes is the pinhole. This is a very small hole that may be the result of physical damage in which a very small object pierces both layers of a wrap tray. Occasionally, a pinhole may be due to a manufacturing defect and can be seen on one of the sheets of wrap. If the pinhole is visible through both sheets of a wrap package, it is probably due to physical damage and not a manufacturing defect. Another type of hole is a melted hole. This is a large, round, or irregular hole with hard welded edges. A melted hole may be the result of the wrap coming in contact with a heat source, such as a hot instrument in a tray that hasn't been allowed to cool sufficiently, or contact with a light bulb in a storage area. Abrasions are another category of wrap tear. An abrasion appears as a fuzzy surface, sometimes dirty or discolored. It can occur when a wrap tray is repetitively pulled over a hard surface. Trays that are repeatedly handled prior to use often display abrasion. An abrasion hole is the result of extreme abrasion with holes in one or both layers of the wrap. The possible causes are the same as for general abrasion, except that the abrasion was repeated often enough to finally result in a hole. Proper tray handling technique is essential for preventing damage to the packaging and compromised sterility. Education and training programs should include information on proper tray handling technique. Continuing education should be provided at regular intervals to review and update worker knowledge and skills and to maintain their competency. All orientation on the job and in-service training should be documented. All central services personnel should maintain a high level of personal hygiene. Hands should be washed or hand sanitizers used as appropriate. Fingernails should be short to reduce the microbial load under the nail and to minimize the potential for rupturing packages and pouches in a way that will contaminate them. Written policies on personal hygiene should be developed, communicated, and enforced. When wrapping, use the correct size wrap for the size and weight of the tray. Always wrap lighter trays and textile packages in lighter sterilization wrap and wrap heavier trays in heavier wrap. This is not only cost-effective, but it reduces the possibility of wrap tears. Do not wrap the tray too tightly. Also, avoid using an excessively large wrapper which may inhibit sterile penetration and release, or may result in excess wrapping material that can catch on surfaces. Trays with small feet or other protrusions should be cushioned before wrapping. And do not overload the tray with instruments. According to AAMI guidelines and AORN recommended practices, the total weight of instrument containment devices should not exceed 25 pounds, including the contents and the containment method. Avoid touching sterile items fresh from the sterilizer until they've cooled. Packs should not be touched until they are cool because hot packs act as wicks, absorbing moisture and therefore bacteria from the hands. Position heavier trays on middle or waist-high shelves, where it's much easier to lift and control them. Avoid sliding trays into place or dragging trays across a storage shelf, sterilizer cart, or table, even if the surface is smooth. Always lift it off the surface it is resting on first and then move it. When moving a package, slide your hand under the package and leverage it on your forearm. Then pull it straight out. Lining storage racks and sterilizer carts with liners or a protective cushion will help prevent pressure holes and pressure cuts when the trays are accidentally mishandled. Avoid stacking heavy trays. As mentioned earlier in the presentation, the reason to avoid stacking is that compression of packages can force air and microorganisms into the package contents, cause seals to burst, or puncture the packaging, any of which may lead to contamination. Importantly, handle packages only when necessary. The greater the number of times the package is handled prior to use, the greater the potential for contamination. Sterile packaged items should be transported in a manner that will protect the items from puncture and from contamination by moisture, excessive humidity, condensation caused by exposure to temperature extremes, insects, vermin, dust and dirt, excessive air pressures, and microorganisms. Written policies and procedures should be developed for the use of specific transport equipment, appropriate handling practices, and acceptable environmental conditions for the transport of sterile packages. It is essential to inspect sterilized packs for damage before issue and use. Central Service is responsible for delivering intact packages, which are inspected before leaving the CS department. Perioperative personnel should also inspect the package before use. According to the AORN standards regarding practices for selection and use of packaging systems for sterilization, quote, the end user should visually inspect the package or container before opening for package integrity, such as free of holes in fabric or paper and effective seal in containers. Remember, in addition to wrap tears, if a package is exposed to moisture, it must be reprocessed. Or if it has fallen or been dropped on a hard surface, it must be reprocessed unless the package is heat sealed in impervious plastic and the seal is still intact. If tearing is a recurrent problem, pay close attention to determine if it's the result of a specific issue. Inspecting and identifying the type of tears may determine the cause and location of the occurrence. Knowing both the type of damage and where the damage occurs helps in selecting the best solution. Some solutions may include going to a heavier strength wrap, breaking down heavy weighted or awkward instrument sets into more than one package, using cushioning materials, or possibly utilizing transport trays or shelf liners. In summary, sterilized wrap packages should be handled carefully to prevent contamination of the contents. This contamination may result from moisture, soil, or physical damage. In this program, we focused on physical damage that included 3 types of tears: cuts, holes, and abrasions. In order to prevent physical damage and tearing, excessive handling, dragging, sliding, crushing, bending, compressing, or puncturing of a package should be avoided. Packaging should be inspected thoroughly for compromised sterility before issuing and use. And if damage does occur, determine the hows and whys and take corrective steps to prevent similar damage in the future. And remember, if there is any doubt about the sterility of an item, it must be reprocessed before it can be safely used. This concludes our presentation on sterilization wrap, tear identification, and handling technique.
All right, so hopefully that was beneficial to you in trying to maybe do some troubleshooting with some of the wraps. And I thought that was a good video.
If you have not already signed in,
Sorry. There we go. So this is our conclusion for Unit 5. If you have any questions, again, please feel free to reach out to me with anything. You guys are doing a great job with your work. I really did enjoy those videos you guys did in your decontam. You guys put the ones of you did it, put a lot of effort into it, and I really appreciate that. So again, feel free to reach out to me anytime. I'll try to help you with whatever you need. So have a great week, and I will talk to you next week. Bye.